Hello and welcome to Chapter 17, the Cardiovascular System. Now, I know that we have been doing our lectures a little differently. We've actually been doing some of the CPT and we've been doing kind of going through guidelines and things like that. The cardiovascular system is going to be a little bit different. It's very large. The cardiovascular system is the largest section in the surgery system. In the surgery section, the surgery section. So we're going to have to take this a little bit differently. I'm going to do the best I can. I want to get into the CPT. So I'm going to try to do our slide share and then stop sharing, and then we'll get into the CPT. But I'm going to have to move the webcam around a little bit. So I just want you guys to bear with me, and we'll get through it. We'll get it done. So get out your CPT manuals, get out your step-by-step book, and let's get this started. Okay, so let me share my screen. Sorry about that, guys. Hang on, let me see. Here we go. There we are. So first of all, let's talk about what is a cardiologist. A cardiologist specializes in the treatment of conditions of the heart and may further specialize in the area of radiology, medicine, or surgery. Cardiovascular codes can come from radiology, medicine, and the surgery section. Just for example, respiratory system codes are grouped together in one section of the CPT, but the cardiovascular system codes are found in radiology, medicine, and surgery. So you could find those in 3 different areas. So let's talk a little bit more about those areas. So the CPT codes that you find in radiology for the cardiovascular system are going to be diagnostic studies. For example, a stress test. And the medicine section is going to be non-surgical or percutaneous. And then in the surgery section, it's going to be open and percutaneous. If you look in your step-by-step book, Figure 17.1 lists the section information that is the most often used when cardiovascular services are reported. So that is actually in your textbook for you to refer to. So let's talk about some coding, cardiology coding terminology. So invasive, what does invasive mean? Invasive procedures break the skin and are used to make a correction or to examine the cardiac system. So invasive simply means it enters the body. For example, opening chest for the removal of a tumor on a heart or a percutaneous placement of a catheter in an artery. In the medicine and the surgery section contain invasive procedures. Both medicine and surgery sections contain invasive procedures. Whoops. So, non-invasive. Non-invasive are procedures that do not break the skin. For example, electrocardiogram. Non-invasive procedures are never coded from the surgery section. Procedures in this category may be coded in the radiology section or the medicine section, because if you're having surgery, it's obviously an invasive procedure. So surgery, they're going to be doing invasive things. Non-invasive are procedures that do not break the skin, and so you cannot code a non-invasive procedure from the surgery section. It will be either radiology or medicine. So let's talk a little bit about electrophysiology, which is called EPS. It's a study of the electrical system of the heart. For example, it could be the study of an irregular heartbeat or arrhythmia. So I'm looking at my CPT right now, and I would like for you to look at yours. And the way that it, well, never mind, let's not do that yet. I'm sorry, I just want to get in the CPT so bad. Let's wait. So that's what an electrophysiology study is. It studies the electrical system of the heart. So nuclear cardiology, our diagnostic and treatment specialty, uses radioactive substances for cardiac conditions, for example, an MRI. Primary codes for these procedures come from the radiology section, where review of diagnostic and treatment information accumulated during the procedure occurs. Some components of the procedure may be coded elsewhere to surgery. For example, medicine, because contrast materials, when you're doing these different procedures, that comes from the medicine. So a nuclear stress test, when you're having to inject the dyes, you're going to code that in the medicine section. Okay, so now I'm going to back up and ask you to open your CPT. So you're going to, I don't want to stop the share yet, simply because when I did that a while ago, it cut me off. So open up your CPT manuals to the cardiology section and turn until you see cardiovascular in green and you see the code 33016. That's under the heading heart and pericardium. Here you're going to find cardiac tumor, transmyocardial revascularization, pacemakers, and implanted defibrillators. And then it's also got a section for arteries and veins, which is going to start at 34001. So go ahead and move on to 34001. And I'm still turning. Sorry. And that's where your embolectomies and thrombectomies start. So I'm sorry, I'm going to just make you go back now to the beginning to 33016. So let's see, what is 33016? What is that CPT code? That is pericardiocentesis, including imaging guidance when performed. So both percutaneous and open procedures can be found here. There are extensive notes, as you can see. You need to read your notes always. Frequent changes with medical advances. Codes in this subheading are used for services to repair the heart, pericardium, or coronary vessels. Why do you think it's important to read all the notes contained in the CPT for a particular section when coding from that section? Well, I'm going to tell you why. Notes contain valuable information that will describe the ways in which codes in a particular area of the CPT can be used. Ignoring these notes can result in many errors. So let's not ignore the notes. Example of heart pericardium subheadings. If you look where it says 33016, you're going to see right above that, that's pericardium. Then the next little blue section, the little blue title says cardiac tumor. And then it has transmyocardial revascularization in mind. I don't know if that's a new code. It doesn't have an indication that it is. But then we move over to pacemaker or implantable defibrillators. So that's going to be found in your CPT. Pericardiocentesis is the most commonly performed procedure of the pericardium. Excision of a cardiac tumor is an open surgical procedure for the removal of a tumor on the heart. So let's look at our cardiotumor little section here. Starts at 33120. We only have 2 codes for that. 33120 says excision of intracardiac tumor resection with cardiopulmonary bypass. And then 33130 says resection of external cardiac tumor. So you really only have 2 choices there. Okay, so I could talk about pacemakers or implantable defibrillators forever, but we have quite a bit of information to get through on our slides to talk about those. So let's just read through our slides and then maybe we can have some fun talking about those later. So pacemaker or implantable defibrillator 33202 through 33273, devices that assist the heart in electrical function. So they're divided by where electrodes or leads are placed, approach, and type of service. Pacemaker electrically stimulates myocardium of 1 or more chambers to contract when heart fails to do so, contract when heart fails to do so. Device can be temporary or permanent. Okay, so you're in your pacemaker or implantable defibrillator portion of your CPT. I would like for you to go to code 33210. That is a temporary pacemaker. I just kind of wanted to point that out. Medicare does not pay for temporary pacemakers, just FYI. Okay. There are also a pacemaker that has 3 leads. Okay, sorry, I've started in a different spot. Let me start again. Okay, pacemakers can be placed in the atrium, which is a single chamber, ventricle single chamber, both dual chamber uses 2 leads, biventricular, both ventricles, and right atrium, which is 3 leads. I know that that sounds confusing, but I want to just go back and bring you to code 33206. When you get there, you'll see insertion of a new or replacement of permanent pacemaker with transvenous electrodes, atrial. Then 33027 is ventricle, and 33208 is atrial and ventricular. The one thing that I want to point out on 33206, it doesn't say electrodes where it says single lead, dual lead on our slide. You have to be careful where your S is placed, because on 33206, it says electrode, or your S is in parentheses, which means electrodes, which means that could be plural, more than 1 electrode or lead. So we have to always be aware of our approaches. We really learned a lot about that in the last couple of CPT sections that we went through. Just be aware of your approach. For example, epicardial, open procedure to place on the heart. Transvenous is through the vein to place in the heart. Type of service is also important when pacemaker and implantable defibrillator procedures are coded. So you need to pay attention to the initial placement, or if it's a replacement of a part or all of it. You could just be replacing the batteries. And you need to be very, very aware of the number of leads placed. Patient record indicates revision or replacement. So, it's a usual follow-up period of 90 days, which means a pacemaker has a 90-day global, and you need to use 78 to indicate returning to operating room with the global procedure. Okay, the only one that I really, really want to hit hard right here, right now, is the global period. So a pacemaker carries a larger global than most things, most procedures. So what happens is, say that I go in for a pacemaker, get out of the hospital, I go home, and I have AFib, which means my heart is beating irregularly, and the pacemaker is supposed to be fixing that. So I have to go in for an adjustment. That means that I don't have to pay because it's covered under that 90-day global. Okay, so say that I go in for a pacemaker, but then I'm having tightness in my chest and they find out it's pneumonia. Well, that's not directly related to my pacemaker. So therefore, the doctor can get paid for that. I want to go up above. The patient record indicates revision or replacement. You're going to know by the patient's medical record if they're getting a replacement or just a boost up. If you have to return to the operating room within the 90 days for a situation to do with that pacemaker, you're going to use a 78 modifier. All right, so we're going to go over one more section just for you guys to be able to feel more comfortable. So we're going to move past pacemakers, and we're going to go into the electrophysiologic operative procedures, and they are going to start at 33250. So go ahead and turn in your CPTs to 33250. Surgeon repairs defect causing abnormal rhythm. Endoscopy procedure without CP. Codes based on reasons for procedure approach and if CP bypass used. So if we're just looking at it like that, we're like, huh? But let's actually look at our CPT. Let's look at 33250 and backtrack to where we're looking at electrophysiological operative procedures. That says the family of codes describes the surgical treatment of supraventricular dysrhythmia. Sorry, guys. And then it gives us some definitions: limited, extensive. So if we look at CPT code 33250, operative ablation of supraventricular arrhythmogenic focus or pathway, and it just continues on. That's some pretty complicated wording, but I want you to understand that we're going to be going through each one of these sections of the CPT. Now, actually, I am actually going to stop our share, and then I'm going to then pull the webcam down. I know this chapter really has me stumped, guys, about how to best teach it. So I just wanted to kind of tell you that as you're as you're going through your step-by-step, get into your CPT and follow along. So I just want to show you that I have actually labeled my CPT the way I always do. And I need you to get in. Now, you're not going to be able to put everything in this chapter because it's huge. But this says heart and great vessels, cardiac valves. Thoracic aneurysm. Heart and lung transplant. Cardiac assist. So just get into your CPTs and begin to explore. See what's there. See what sections are there. See what you think that you need to make notes on. The best way to learn this is not just by looking at the main terms. You know, I have it right here. I gave you guys a little, I call them little cheat sheets, but they're not really cheat sheets. The easiest ways to search for cardiac surgery main term, and I gave you those little things, and then all of your main terms. Get in, look for these terms as you're going through. Label these terms with your little labels. See, I label everything. Get to know it. The only way that you're going to get better and better at coding is to know your tools. This CPT is a tool. It's a major tool. Learn how to use it. I know this wasn't the most exciting lecture, I know, but this is only part 1. Tomorrow we'll do part 2, and hopefully it's all going to come together and you're going to be like, man, I'm excited to code cardiology. I was a cardiology coder for 4 years. I loved it. Didn't use nearly as many codes as were available to me, but you guys are going to get it in the end, and I just want you to read and explore and do the work. If you do the work, if you start looking, you start highlighting, you start labeling, you start doing the things I'm telling you, when it comes to coding it, it's going to be like, I remember that. I know where that is. Oh, I know what that is. I'll research that. I watched a video on that. Be your own hero in this. Start researching. Start looking. Have a wonderful day and happy coding. Woo. I'm jiggling my webcam.